It's now 6:31. More news now. Open enrollment for the Affordable Care Act, also known as Obamacare, begins October 1st, which is in less than 1 week. But many people still have questions about what this means for their health care coverage and their wallets.
New figures are out now. Now, these are from the White House. They give a preview of what the White House says people can expect. For instance, White House claims a family of 4 with an income of $50,000 a year would pay on average $282 a month with tax credits. Senator Ron Johnson joins us live via satellite this morning to talk about what we need to know about the changes. Senator, we're going to be asking all of our lawmakers there in Washington to give us their top 4 things people need to know about Obamacare. But let me start you off with an issue that you've spoken about a lot. The administration continues to promise if you like your health care coverage now, you can keep it. But we're already seeing major U.S. companies restructuring plans and work hours that will force people out of employer-based health care.
Good morning, guys. You're exactly right. Even the city of Chicago, in other words, President Obama's former chief of staff, Mayor Rahm Emanuel, is now saying that Chicago's retirees are probably going to get dumped off of their health care plan and forced to really trying to secure insurance through the exchanges. So that promise of President Obama, if you like your health care plan, you can keep it, has definitely been a broken promise, as we've seen tens of thousands of Americans just very early on lose their employer-sponsored care and get dumped in the exchanges. And by the, as this thing gets fully implemented, there will be millions of Americans that lose their health care plan that they wanted to keep, that they like, but they're not going to have that freedom, that option.
And Senator Johnson, this issue obviously very confusing as well for a lot of Americans. Now let's get to the 4 points. What do you think the 4 things are that our viewers need to know about the Affordable Care Act?
Well, first of all, the IRS is going to be the primary enforcement agency of the health care law, and they're going to be sharing your personal information with 6 other agencies. But don't worry, because in hearings they've said they're going to really secure that information. This is the agency that lost $67 million recently and also has targeted political opponents, I think, in a very illegal way. Next, this administration, without legal authority, has granted Congress and their staff special treatment under the laws. I'm going to sue to overturn that ruling. Third, the Independent Payment Advisory Board, that's basically the rationing panel. And fourth, just watch the dysfunction of Washington, D.C. over the next couple weeks and understand that it is the federal government that is going to take over a greater share of your health care system. I don't think that's the way to go. I think we really need to rely more on a free market enterprise system.
Senator, what about efforts to then block the implementation of the plan? This was passed by both houses of the legislature. It was signed by the president. Shouldn't it be allowed to at least have a chance out there and then let the public decide then, perhaps at the midterms or the next time the White House comes up?
The reason this is so unsettled is because the health care law was passed on a purely partisan basis. And Nancy Pelosi, of course, very famously said, we have to pass this health care law to find out what's in it. We were already over 20,000 pages of law, rules, and regulation. This is 3.5 years after the passage of the law. It's still not ready for prime time. They've only written about half the regulations. This is chaos, which is one of the reasons President Obama has delayed all kinds of different parts of this law, even though he has no legal authority to do so. So this is going to be a train wreck. That's what Senator Harry Reid said. That's what Senator Mike Spauca said. It's really what President Obama is implicitly acknowledging by delaying other parts. We ought to delay this health care law for at least another year. Let's run a mandated election to see whether or not we should fully overturn this, or at least give the bureaucracy time to make this thing workable in some way, shape, or form.
Senator Ron Johnson, thanks so much for your time live from Washington this morning.
Have a great day.
All right, you too. And in order to help everyone understand health care better, we have reached out to all of our local lawmakers. So we hope that they will take the time to speak with us and give us their perspective. And in fact, we will be speaking with Senator Tammy Baldwin later this morning.
And we'll look for that today on Live at Noon and subsequent broadcasts as well.
Still ahead on Live at Daybreak on Today.